How are you doing? Grade 12.
Fine, alhamdulillah. How about you?
Okay, I'll share my PowerPoint with you. Today, girls, we'll take we finished previous time when we talked about the general anxiety disorder and the phobic disorders, right? And PTSD. What was PTSD, if you remember, girls? PTSD. Post, yes, yes, post-traumatic stress disorder. Today we'll take section 3, somatoform and dissociative disorder. Somatoform and dissociative disorder. We'll start with the somatoform disorder. I will share my PowerPoint, but it's just turning on. We have a quiz after a week, girls. Not week 13, week 14, inshallah, we'll have a quiz. Okay?
Okay.
I'm still turning my PowerPoint on. It takes time. So open page 460, girls, section 3. 460. Is it? Somatoform disorder, girls. What is somatoform disorder? Somatoform disorder is when you face physical symptoms. Okay, physical, it means in your body. You have pain in your body, brought about psychological distress, but the reason is not physical. The reason is psychological distress. Okay, so there is no apparent physical cause. Yani, the rest hurts you, but there is no physical cause. When you go to the doctor, you make X-rays, you don't find any cause. You have a headache, but when you go to the doctor, you make X-ray or MRI, you don't find any cause for the headache in your head. Okay, this is called somatoform disorder, when you have physical pain, but the reason is psychological, not physical. Sigmund Freud, and Sigmund Freud is the one who started the first one. Who I will tell you in the second slide, but at the time of Sigmund Freud, this disease was called hysteria. And hysteria was, even we say it in Arabic, it is a term for unexplainable fainting. Okay? When the person is fainting all the time, he is so fatigued all the time. Here, Sigmund Freud, he was Austrian, from Austria, Germany, and Austria, an Austrian neurologist, the study the science of neurology in the body, and the founder. He is the one who established psychoanalysis. What is psychoanalysis? Psychoanalysis is a way to treat the patient by dialogue. Before Sigmund Freud's way, the only treatment for people who had psychological problems, they were put in the asylum, they get electric shocks, they will trapped in their beds, and that's it. Tied in their beds, and that's it. But when Sigmund Freud started this, they start to treat people more humanly. So they call him the founder of the psychoanalysis. Okay. At that time, he said that those people who face physical pain without a main reason in their body, it's called hysteria. Okay, this is it. Unexplainable actions. The body functions, they do not function well with no apparent reason. Okay, we have two kinds for somatoform disorder, two kinds. We have the conversion disorder and we have hypochondriasis. Conversion and hypochondriasis. The conversion disorder is the first one. Conversion disorder, conversion of emotional difficulties into the loss of a specific psychological function. When she wants to stand up, she can't stand up. Her knees doesn't help her to stand up. Okay, she wants to write, she cannot write, or he cannot write because his hand doesn't help him to write. There is nothing wrong in his hand. His hand physically great, but psychologically he cannot. While the loss of function is real, the actual physical damage is present. No actual physical damage is present. There is no physical damage, but his body cannot function well. This is conversion disorder. Many people of us occasionally experience mild conversion disorders, such as when they cannot move their legs when they face danger. Okay, did it ever happen to you girls when you face danger you couldn't move off your place? Hello, girls?
Yes, miss, a
Yes,
lot
did it?
of time.
What happened? Who's talking first?
Alia.
Alia? Yes.
Yes.
What happened, Ali?
Uh, when I face fear, sometimes I feel like my leg doesn't help me to stand up, like
Yes.
it's shaking or
Uh,
something like
yes,
this.
and this is for a temporary time. Okay, so this,
Yes.
all of us, it happens that we face these problems. But conversion disorder, يعني when this lasts for a long time, not situational only, it lasts with you. So psychologists, those people who study psychology, believe that people suffer from conversion disorder unconsciously, invent physical symptoms freedom, to gain freedom from unbearable conflict. What does it mean? Okay. They have a conflict. They have a problem in their life. They face any conflicts. So what do they do? They escape from these conflicts, okay, to this illness. So their body or their mind invent another sickness in their body, so they distract themselves from the main conflict. Again, when you have a conflict, when you face a conflict and you want to distract yourself from this conflict, what do? You, your body works or functions to imagine another pain. So when you think of this other pain, you get distracted from the main pain. Got me? A woman may lose the power of speech when she lives in terror of blurring out things that she does not want to say. When she has lots of things inside her and she wants to talk, suddenly she finds herself unable to talk. Girls, are you here? Grade 12?
Yes, miss, really.
Yes. Are you with me?
Yes,
Yes.
yes.
I'll tell you a story. Once when we were young, we were at the sea, my family and I, and my sister, she was sinking in the water. There came like this little wave that takes people away because the shore itself was not safe, but they rescued and they swam in the shore, in the sea. And she kept saying, "I'm sinking," but she was laughing. She was so afraid. She knows how to swim, but she was really sinking. And then no one noticed that she is sinking, except two men. They were away and they saw her waving and this, and they tried to rescue her, but they were almost dying with her. At the last second, their third friend rescued the three of them. After this, yani she, for like 10 minutes, my sister stopped talking for a week. She stopped talking because she experienced that she wants to scream, but she couldn't scream. She was, I'm thinking. She was in a trauma like this, so she couldn't speak. And suddenly she spoke. Yani she suddenly spoke, but she spent the week mute. She couldn't open her mouth. Why? Is something happened to her tongue? Something happened to her brain? No, nothing. Everything functions well. But because she held the screams inside her, when she couldn't open her mouth, she couldn't scream, that's gave her the opposite. She stopped talking. Okay? Like when you face fear, you just, you're so afraid. You should run. No, your legs don't carry you, don't help you to run or to escape the fear. Okay, girls, with me?
Yes, ma'am.
Okay, here cause of somatic symptoms or somatoform disorder. Maybe it's family history. As we said, most of the psychological diseases, most of them are inherited, or inability to handle emotional issues. So instead of thinking that she has to, for example, if she has a close friend and this friend left her for another friend, or she loved someone and then he left her, she has an ability to handle the emotional issues, the emotional loss. She loses someone she loves. So what does she feels like her body aches her. She cannot leave her bed. She can't eat. Okay? If he loses his job, he stays alone at the house, refuses to go out. He distracts himself from the main conflict by escaping to other conflicts. Maybe she already has personal negative personality, or she is a very hypersensitive sensitivity to pain. She's so sensitive to pain. So pain, what I mean with pain is psychological pain. She escapes to physical pain. So conversion disorder, a person suffers a loss of physical function. She cannot move, a loss in movement, a loss of vision. She can see well, her eyes function well, but she cannot see. She cannot see well. Loss of feeling in a hand or arm, cannot write, she cannot move her hands. There is no physical cause for these symptoms. Conversion disorder. Conversion disorder is the first kind of somatoform disorders. Here, I am blind, I can't see, my eyes are totally fine, but I don't want to see any more murders, so I got myself somatoform disorder. Maybe he witnessed a murder, maybe something bad I doesn't want to see again. So he says, I can't see, I'm blind. He really can't see. He doesn't imagine. He really can see. But his eyes are functioning well. His mind is functioning well, but he really cannot see. Here, I'm going to recommend a psychologist because you may have conversion disorder. Someone who goes to the doctor, he checks everything, but he is really sick. He really cannot see. He really is mute. She really cannot open her mouth and talk. But the reason is not physically. The reason is psychologically. This is conversion disorder. The second kind of somatoform disorder is the same. It's like conversion disorder, is when you have pain. But hypochondriasis is when you imagine this pain. So a person with good health, and he becomes preoccupied with imaginary elements, especially those people who grow up, they feel like they are so close to their death time. I'm sick, I'm sick, I'm sick. I have a headache, I have a pain, I have a back pain, I have a stomach pain, I have a chest pain, I have pain. So they are at the hospital all the time. This is what hypochondriasis is. The hypochondriac person spends a lot of time looking for signs of serious illness and often misrepresents minor aches, pain, bruises, or bumps as early signs of fatal illness. Oh, I see a bruise here. There is no reason for this bruise. I surely have a bad disease. So despite the negative medical tests and physical evaluation and everything is well, but he also always says, I'm sick, I'm sick, I'm sick. Yeah. His health is well. Not like conversion disorder. Conversion disorder, he really has a malfunction in his arm. He really cannot move his arm. But hypochondriasis, what he pretends that he cannot move his arm. So he is in a good health, but when he looks in the mirror, he sees that he is really sick. This man goes again to the doctor. Oh, I have my heart, I'm dying. I'm crying. I have diseases in my colon. I have to find, I have pain ache, chest ache, stomach ache, arm. And then the doctor says to him, you have nothing. You have hypochondriasis. It's when you imagine you have pain, but you do not have the pain. Okay? Here in figure 16.8, girls, in your book on page 461. Can anyone read the figure, please? No one is here? All of you slept, or where did you go? Grade 12.
I'm here.
Anyone, please, read for me this figure 16.8.
I can read it.
Yes, please. Who are you?
Siham.
Okay, Siham, please.
To 25th doctor's visit, proof hypochondriasis.
No, it is in on page 461, the figure 16.8, this picture at the end, the comic. Some people.
Oh, I don't have the book till now.
Till now you didn't get the booklet?
No.
Okay, do anyone else, girls, have the booklet?
No, Miss Walla, I didn't get it. I do.
Yes, please read on page 461.
Is it figure 16.8?
Yes, who is going to read?
Randa.
Okay, Randa. Yes, حبيبتي, read it.
Some people may accuse those suffering from hypochondriasis of faking their illness and preventing their own happiness. These people, though, do not fake their symptoms. They unrealistically interpret normal aches and pains as symptoms of more serious illnesses.
Yes. So he says to you that by this way you avoid happiness. Whenever you are in a good mood, I'm dying. Okay? So girls, somatoform disorder, again, somatoform disorder is divided into two parts. Conversion disorder, hypochondriasis. Conversion is when you really have a problem, but there is no physical reason. The reason for the problem is psychological. Okay? The second kind is hypochondriasis, and hypochondriasis is when wait a minute. Hypochondriasis is when you imagine this. You imagine that you are sick all the time. You imagine that you're dying all the time. Oh, I have a headache. Maybe I have a tumor in my brain, and this is it. This is how it functions. He has a bruise. Maybe I have, God forbid, he thinks he has cancer, and that's it. Okay, watch this video. I'm playing a video for you guys. 1 minute.
Few weeks to create these really fun videos to share with patients, prospective patients on social media.
Hi.
Girls, can you see my YouTube?
Yes, Miss, we can.
Yes.
And treatment approaches to...
Can you hear?
Yes.
Hello everyone, this is Dr. Jones from drbean.com. Today in the psychiatry series, we're going to be discussing somatoform and related disorders. In this lecture, we'll discuss the presentation and treatment approaches to such disorders. So let's look at the first case. Deborah is a 44-year-old woman who has visited the doctor multiple times, and none of them have been able to diagnose her condition. Today she presents with ankle pain, chest pain, back pain, headaches, blurred vision, bloating, chest tightness, tingling in her fingers, aching in her legs, and ear pain. Does anyone know what the diagnosis is? Well, this case illustrates somatic symptom disorder. Why? Well, it's a disorder where one or more somatic symptoms that are distressing result in problems in functioning. Well done if you got somatic symptom disorder, by the way. So in terms of risk factors for somatic symptom disorder, well, this disorder affects women more than men. It's usually inversely related to socioeconomic status. It usually begins by the age of 30. Data suggests that there may be a genetic linkage to somatic symptom disorder. Within families, male relatives tend to have antisocial personality disorder, whereas female relatives tend to have histrionic personality disorder. What typical symptoms may you see? Well, many physical symptoms affecting many organ systems, excessive thoughts, feelings, or behaviors related to the somatic symptoms, long, complicated medical histories. Interpersonal and psychological problems may also be present, commonly associated with major depressive disorders, personality disorders, substance-related disorders, generalized anxiety disorders, and phobias. Patients will usually seek out treatment and have a significant impairment in their level of functioning. So how do we treat these individuals? We must have a single identified physician as the primary caretaker. Patients should be seen during regularly brief monthly appointments. Should increase the patient's awareness of the possibility that the symptoms are psychological in nature. Individual psychotherapy is needed to help patients cope with their symptoms and develop other ways of expressing their feelings. The main key message overall I want to echo is safeguarding. These patients with somatic symptom disorder, they should only have one physician to see them on a regular basis, given the fact that in the future something physically wrong may actually happen to them, and you need to be able to pick up on that. So let's look at another case. Jen is a 25-year-old female, and she presents to the clinic unable to move her arms, her upper arms and her lower legs. A full workup is done, no abnormalities are seen. However, when further questioned, she reports an argument with physical violence involving her girlfriend that occurred this morning. And since this morning is when she hasn't been able to move her upper arms and lower legs. Does anyone know what diagnosis this is?
Get a real-time bird's eye view of your projects. Create project plans.
Well, this case illustrates something called conversion disorder. Why? Well, it's a disorder in which the individual experiences one or more neurological symptoms that cannot be explained by any medical or neurological disorder. So basically, as a result of the fight with the girlfriend, she's kind of taken this experience and now she has neurological symptoms as a result. In terms of risk factors or epidemiology for conversion disorder, it's seen more frequently in young women. It's seen more commonly amongst lower socioeconomic class, rural populations, low IQs, and military personnel. Commonly associated with passive-aggressive, dependent, antisocial, and histrionic personality disorder. Typical presenting symptoms may be the following: one or more neurological symptoms which affects voluntary or sensory functioning, must have psychological factors associated with the onset or exacerbation of the symptoms. Mutism, blindness, and paralysis are the most common symptoms. When it affects the sensory system, you may get anesthesia or paresthesia, so it basically means numbness or tingling. When it affects the motor system, you can get abnormal movements, gait disturbances, weakness, paralysis, tics, jerks. Patients may model their behavior on someone who is important to them. So how do we treat these patients? Well, psychotherapy to establish a caring relationship with the treater has focusing on stress and coping skills can really help. Briefly monthly visits as well with partial physical examinations can help. So let's look at another case. Miley is an 18-year-old singer and she presents to the doctor convinced she has bladder cancer. She reports constant abdominal pain that doesn't go away. She has seen doctors numerous times and she's told there's nothing wrong with her. She doesn't believe them, but she thinks that you can help her because she knows 100% there's something wrong with her. Do you know what diagnosis this is? This case illustrates illness anxiety disorder. It's a disorder characterized by the patient's belief that he or she has some specific disease, despite constant reassurance that the patient's beliefs still remain the same. Symptoms must occur for greater than 6 months. In terms of risk factors or epidemiology of the illness anxiety disorder, men and women are affected equally. The most common onset is between the ages of 20 and 30. Typical presenting symptoms may be the following: preoccupation with disease. Preoccupation persists despite constant reassurance by physicians. The belief is not delusional. The preoccupation affects the individual's level of functioning. Duration is of at least 6 months. And how do we treat illness anxiety disorder? With psychotherapy to help relieve stress and help cope with the illness. Frequent, regularly scheduled visits to patient's medical doctor helps as well.
So you got the idea, girls? You know now what is somatoform disorder and what the two kinds of it? Somatoform disorder divided into conversion disorder and hypochondriasis. Conversion disorder is when there is physical pain, okay, but the reason is psychological, but there is a physical pain, there is a malfunction in their bodies, okay, although that their physical parts are good, but the reason is psychological. Hypochondriasis is when they pretend they have, not pretend, they imagine they have. Okay?
Okay.
See you next week, guys. Have a nice week. Bye, guys.
Bye.
Bye, Miss.